healthcare at its root is really about very, very positive and constructive relationships between people. And those relationships are built on a trusting exchange of information. Patients come in with concerns regarding their health. They share that information with a healthcare provider, be it a doctor, a nurse, or a pharmacist. And then together they use that information, process that information to come up with a care plan that makes sense for that patient. And the best health outcomes and the best therapeutic alliances come from an information exchange that is respectful, that is complete, and is secure. Now, historically, that exchange of information between patient and clinician has been done face-to-face. But as we know, and as Tyler mentioned, in 2020, most health information is happening digitally. You can be at home and you can do your banking and you can order food and you can stream some shows and you can adopt a pet. You can donate to your favorite charity and you can plan a vacation, all from the comfort of your home. However, if you want to access your clinician or if you want to access your health information, that's something that's currently pretty hard to do. Now, as Bill mentioned at the intro, is that Alberta is actually leading Canada in terms of what is available in terms of online health information. And in 2010, when the Institute was kicking off, at that time, we were already pretty far along in terms of national comparators in the eHealth space. In Alberta, we had Alberta NetCare, which is a very impressive repository of data on patients' laboratory results, their diagnostic imaging information, pathology results, and all the reports that come from their interactions with Alberta Health Services, be that through a hospital admission or through procedures or through consultations with specialists. NetCare provided a place where registered healthcare providers could log in and see the same information on the same patient no matter where they were in the province. And so this was a huge innovation for healthcare providers, but it was limited to healthcare providers. In 2015, the Alberta Health announced their eHealth strategy, a vision to expand eHealth services in the province. And their eHealth strategy had 4 key pillars. The first was that they envisioned procuring and implementing a clinical information system that would connect all Alberta Health Services facilities in the province. They envisioned a collection of data from community healthcare providers so that your family physician, your community-based specialist, they would input data into NetCare so that if you showed up at the emergency department or you required emergency surgery, all of your interactions with your family physician, your existing care plans, your stated care priorities were something that your now new care team would have immediate access to. The strategy also included an evolution of the existing NetCare, one that expanded to include patients, include patient access, include patient-collected health information. And finally, the last pillar of the eHealth strategy was a very highly intelligent, highly informed approach to secondary data analysis so we can ensure ongoing quality in the system and ensure ongoing quality improvement. And so this is where, through Bill's leadership and through the passion and the interest of a number of Institute members that were interested in eHealth, but also in health service delivery and patient-centered care, nurtured relationships with our partners at Alberta Health and Alberta Health Services to ensure that we could help bring that strategy to life in a way that was really going to best serve Albertans. This paper, Health Information Exchange, Engaging Providers in Healthcare Innovation, is one example of a contribution of Institute members. In 2016, the Health Information Executive Committee at Alberta Health and Alberta Health Services commissioned the O'Brien Institute to write a report really trying to motivate healthcare providers in the province to open their EMRs, their electronic medical records, and share their data. Because the eHealth strategy was contingent upon robust provider engagement, ensuring that they were going to share all of the relevant health information that was going to help their patients no matter where they were in the province. And this paper ultimately provided a roadmap for Alberta Health and Alberta Health Services to help engage providers in that task. The second area in which O'Brien has been extraordinarily powerful in moving the eHealth agenda forward is in terms of developing in implementing and evaluating specific eHealth innovations or digital solutions. And so one example is a project that was led by the W21C, which was an electronic discharge tool that helped ensure safe transitions from patients from hospital to their community care teams. This standardized reporting of events in hospital and was rigorously evaluated and found to have very positive impacts on patients' health and long-term outcomes. Another area that we've been really leading the field is in the area of clinical decision support. And this is my colleague, Matthew James, who is an international leader in clinical decision support in terms of trying to help physicians make good decisions around their patients with kidney disease, trying to prevent unnecessary kidney injury when they're undergoing procedures in hospital. So now, 10 years in 2020, Alberta has moved a great deal forward in terms of the eHealth space and have largely achieved many of their strategic objectives laid out in the plan that they put forth in 2015. And the O'Brien Institute has been there bringing that vision to life, informing every step and making sure that, again, the strategy as it's animated is in a way that's well informed and serves the needs of Alberta's patients. Where we're at right now is that instead of just having this one repository, NetCare is now open to patients. It does have a patient portal so that patients can have access to all of their immunization records, limited laboratory results, and prescription medications. And as of the fall, the clinical information system, ConnectCare, has been rolled out in Edmonton and is going to be rolled out throughout the province over the next 3 years. And this will connect patients to all their AHS records and all investigations and clinical care summaries that happen at those sites. So really, the Albertan has really been, has unprecedented access to their health information, in large part due to the leadership of the province, but also in no small part due to the contributions of my colleagues at the Institute for Public Health. So with that, I will close and thank you again.